1 in every 8 men will be diagnosed with prostate cancer. It's the second deadliest cancer among men. The disease is silent, often showing no clear symptoms in its early stages. That's why early detection is absolutely crucial. The good news: prostate cancer has a high cure rate when caught early. Over 90% of early detected cases have a good long-term outlook. Knowledge and awareness of the warning signs are key to staying ahead of the disease. 3. Risk factors. The main risk factor is age, especially after 50 years old. Other factors include family history and lifestyle habits like poor diet and lack of exercise. The 8 silent signs. These symptoms can be subtle, but they may be your body's way of warning you that something's wrong. 1. Frequent urination, polyuria. Needing to pee more often than usual, especially waking up multiple times at night. 2. Urinary urgency. That sudden, uncontrollable urge to run to the bathroom right away or risk an accident. 3. Feeling like your bladder is still full. Even after you've just gone, you feel like you didn't empty completely. 4. Rectal pressure, or a sense of incomplete bowel movements. It may feel like constipation or hemorrhoids, but it could be your prostate pressing on the rectum. 5. Persistent lower back pain. Unexplained pain in the lower back or hips can be a sign the cancer has spread to the spine. 6. Blood in urine or semen. Even a small amount of blood in your urine, hematuria, or semen, hemospermia, should never be ignored. 7. Painful ejaculation. Pelvic pain during or after sex can be a warning sign of something deeper. 8. Unexplained weight loss and extreme fatigue. If you're losing weight without trying or feeling constantly drained, it may signal advanced cancer affecting your metabolism. Frequent urination when you're going to the bathroom more than usual. What is frequent urination, polyuria? Frequent urination, also known by the medical term polyuria, means needing to urinate more often than normal. Typically, a healthy person urinates about 6 to 8 times a day, and no more than once during the night. But if you find yourself going to the bathroom far more often, especially if you're waking up several times during the night, that could be an early warning sign. Why does this happen in prostate cancer? As men age, it's common for the prostate to enlarge. But when the growth is abnormal, whether due to benign prostatic hyperplasia, BPH, or cancer, the prostate can begin to press against the urethra, the tube that carries urine out of the body. This partial blockage puts extra pressure on the bladder, forcing it to work harder. That leads to symptoms like feeling the need to urinate more often, trouble completely emptying the bladder, waking up multiple times at night to urinate, nocturia. How can you tell if it's something serious? Frequent urination can be caused by less serious conditions, like a urinary tract infection or benign prostate growth. But in the case of prostate cancer, this is often one of the first silent symptoms to appear. The problem is, many men ignore it, assuming it's just part of getting older or because they drank too much water before bed. But when this symptom becomes persistent, especially if it comes along with others, it's time to see a urologist. Small blue diamond, when should you be concerned? Keep an eye out for these signs. Urinating more than 8 times a day, even without drinking much fluid, waking up 2 or more times during the night to pee, feeling urgency, or struggling to hold your urine, the sensation that your bladder isn't fully empty after urinating. These could all be signs of something more serious, and they deserve medical attention as soon as possible. Key message: urinating more often than usual might seem harmless, but it could be the first signal your body is giving you about a more serious condition. Don't ignore it. Your body is speaking to you. Urinary urgency, when you have to rush to the bathroom. What is urinary urgency? Urinary urgency is that sudden, powerful urge to pee the kind that hits out of nowhere and makes you feel like you have to go right now, or else you'll have an accident. This is not just about needing to use the bathroom. It's a strong, uncomfortable sensation that often comes on so fast, you barely have time to react. What's the link to prostate cancer? As the prostate grows, whether due to benign changes or a cancerous tumor, it can press against the urethra and irritate the bladder. That irritation causes the bladder to contract before it's full, creating a false sense of urgency. So, even when there isn't much urine there, your body tells you to go urgently. This can be one of the earliest signs of prostate cancer, which is why it's such an important red flag. Why is this symptom concerning? Many men brush it off, blaming it on aging, cold weather, too much coffee, or stress. But when it happens frequently and starts interfering with your daily life, it could be a sign that something more serious is going on. Some men feel embarrassed about not being able to hold it, especially in public or during sleep. It can take a toll on their confidence and overall quality of life. When to seek medical help, you should talk to a doctor if you experience frequent, sudden urges to urinate, an uncontrollable need to go, even right after you've just gone, leaking urine before reaching the bathroom, urinary incontinence, urgency combined with other symptoms like weak flow or pain when urinating. Key message: if you feel like you have to drop everything and run to the bathroom, like you can't wait even a minute, your body is trying to tell you something. Don't ignore the message. Like, comment, and share. It could help save lives. Drop a 1 in the comments if you found this helpful, or a 0 if you think we can improve. Subscribe for more content focused on men's health.